Hello, my name is Sarah Guy and today I'm going to present to you a stress and stress management presentation. So, what is stress? Well, stress is a mental or emotional drain where an event or situation can cause mental or physical pressure. Stress will affect most people in their lifetime. Stress is a physical response and it's the body's way of protecting itself from harm. There are 4 types of stress: time stress, anticipatory stress, situation stress, and encounter stress. Time stress can be anything from worrying about being late, sleeping through an alarm, or missing a flight. Anticipatory stress could be anything from waiting for an exam, waiting for results from a medical appointment, or waiting for a parcel. Or, like many of us, waiting for lockdown to end. Situation stress can be meeting someone who makes you feel anxious, a job interview, a date, or meeting with an ex. Encounter stress can be encountering people around you, from interacting with other people, social anxiety, and sometimes just encountering other people can genuinely feel overwhelming. So, the next slide we shall move on to is GAS, which is also known as the General Adaptation Syndrome. The General Adaptation Syndrome. This is an alarm reaction. So upon encountering a stressor, a body will react with a fight or flight response. A hormone called cortisol will be released into the bloodstream and will start running around your body. The alarm reaction can be if you have a fear of spiders and you see a spider. Firstly, you will react with fear. Then you will go into the fight or flight response. Once you've encountered the alarm reaction, your body will go into the resistance stage, where your body will return a lot of its physiological functions back to normal. However, your blood glucose levels will remain high and cortisol will still remain running through your bloodstream as your body focuses against the stressor. The exhausting stage. Stresses continue and the body can't cope anymore. Because the body exhausts all its resources, it leaves the body exposed to disease, infection, or unfortunately even death. And this is because the cortisol and the blood glucose levels remain high. What is the fight or flight response? Well, the fight or flight response is an automatic physiological reaction to an event that is perceived as stressful or frightening. The perception of threat activates the sympathetic nervous system and triggers an acute stress response that prepares the body for flight or flee. So the brain will signal to the adrenal glands. It can end up with fast breathing. Stomach can end up gurgling. You may feel like you need the toilet. That's what you feel in the fight or flight response. So what can stress you out? Well, work stress, family stress, exams, relationship, being late, people. Work stress can be anything from being in a new job. You may have a boss that's putting loads of pressure on you. The colleagues you work with may stress you out, they're demanding, or you just feel intimidated by them. Family. Maybe your brother is in and out of a relationship and he's back and forth trying to get custody of his child, and because of that pressure he is stressing you over it. Maybe your parent is poorly, your child is struggling in school, or general stress like making sure your children do their homework. Exam stress. Well, the pressure of trying to produce distinction level work, preparing for an exam, studying with outside distractions like children, wanting to get high marks, and because you have work commitments you worry you won't be able to get enough marks. Relationship stress. Unhappy in a relationship and don't know how to leave. Maybe your partner isn't being supportive and he's putting loads of pressure on you. Moodiness, irritability, and not understanding, which is causing you to feel pressure. Maybe you are putting an enormous amount into the relationship but aren't getting anything back. Being late really stresses you, where you worry social services will get involved if you keep being late for school. Or maybe you worry that lateness to work is going to end up in you being sacked. People. Maybe your friend is going through turmoil and is always calling you for support, but instead it is just genuinely stressing you out. Maybe someone you have spoken to on the phone was rude, or even someone on a bus is chewing and that's just annoying you. That is what can stress you. So how do you respond to stress? Do you respond negatively or positively? Next, we are going to look at the relationship between stress and personality. Now, there are 4 types of personalities: type A, B, C, and D. Individuals are different and each person responds to stress differently. Your cognitive reaction plays a major role in how you will respond. Some people are born with a calmer temperament, whereas others are born with more of a temper. You can learn how to react from events in your childhood or even nature-nurture. Now, type A personality is the director personality. This personality is very goal and oriented, stress resistant and can handle it well, and is a big risk taker. Type B personality is the socialiser. Enjoys always making group events, socialising with people, very relationship orientated, outgoing and super enthusiastic. Type C personality is the thinker. Personality is always very detail orientated, very logical at thinking, and is always prepared and very organised. Type D personality is the supporter, very task orientated, stabiliser of the personality, very supportive, and very, very cautious. So this is the relationship between stress and personality. Life events theory, also known as the SRRS. SRRS means the Social Readjustment Rating Scale, and it's by Holmes and Ray. In 1996, Holmes and Ray developed a questionnaire called the Social Readjustment Rating Scale for identifying major stressful life events. Each one of the 43 stressful life events was awarded a life-changing unit depending on how traumatic it felt. So, a total value for stressful life events can be worked out by adding up the scores for each event experienced over a 12-month period. On the left-hand side of the presentation, you will see a scale with life events on. Number 1 is death of a spouse, and that mean value is 100 points, and it goes all the way down to 41, which is a vacation, which is 13 points. So if you score over 150 points, that means that within the next 6 months you are susceptible to being ill. If you score over 200 points, you are more susceptible to having a mental breakdown in the next 2 years. And if you score super high, over 300 points, that means that it raises your chances of death more at about 80%. So this is what Holmes and Ray developed in 1967. Changes to our body when we get stressed. Well, short term, you may feel worried, nervous, or are unable to switch off. Heart beats harder and faster to pump more blood to major muscles. Breathing quickens to send more oxygen around the body. Tummy issues due to the rush of stress and hormones circulating your body. Your skin becomes sensitive and oily. Problems between the sheets. Muscles tense up as if they're preparing to make a run for it. Again, like the fight or flight response we spoke about earlier. And long-term tension, head and migraines. Mental health problems from anxiety and depression, serious heart problems, trouble breathing, hyperventilation and panic attacks, skin and hair conditions, acne, hair loss, increased risk of type 2 diabetes, and for both men and women, fertility problems. Now, there are common symptoms of stress, and these common symptoms can be everyday stresses, like if you have a letter through the post where you need to pay a bill and you don't get paid for 10 days, but that bill needs to be paid within 4 days. These are the common symptoms of everyday stress. Sweaty palms and sweaty armpits. Increase in blood pressure and heart rate. Rapid or very shallow breathing. The feeling of a knot inside the stomach. Nausea. Being sick. Headache. Change in mood. Change in sleeping patterns, change in appetite, forgetfulness, muscle tension, migraines and low sex drive. So these are the common symptoms. Now, moving on to the more serious side effects, and this is due to prolonged stress, and this is months and months and months of stress. So for women, missed periods. For both male and female, weight gain, depression, anxiety attacks. And Johns Hopkins University did a study, and they linked that stress can be linked to causing cancer. Stress can ruin your heart and cause a heart attack because of the increased blood pressure around your heart. Stress can lower your immune system and make you susceptible to infections, viruses, the flu, and it can also promote diseases. Stress can ruin your teeth and gums, and you're probably sitting thinking, well, how? Well, if you're stressed and you go to bed, then you could grind your teeth or chewing your nails, which can ruin your teeth and gums. Stress can make you look older, and this is due to the constant hormone change and the cortisol constantly running around your body. It can change the skin texture and can make you look older. Stress has also been known to lower your bone density. Now, on the next slide, we have got 2 photos of, again, stress and what it can cause from brain and nerves: headache, feeling of despair, lack of energy, sadness, nervousness, anger, irritability, increased or decreased eating, trouble concentrating, memory problems, trouble sleeping, mental health problems such as panic attacks, anxiety disorders, and depression. Stress can affect your skin and can cause breakouts, really bad acne, or even psoriasis. Muscles and joints from muscle aches and tension, especially in the neck, shoulders and back. Increased risk of reduced bone density because of the stress on the joints. Your heart, because your heart is beating faster, the rise in blood pressure increases the risk of cholesterol and heart attack. Stomach, nausea, stomach pain, heartburn, weight gain. Even your pancreas, increased risk of diabetes, intestines, diarrhea, constipation, and other digestive problems like diverticulitis. And stress has also been linked to Crohn's disease. Reproductive system. For women, irregular or more painful periods, reduced sexual desire, and for men, impotence, lower sperm production, and the reduced sexual desire. Immune system, lowered ability to fight or recover from illness. Nervous system, because the heart is beating faster, your body is always perceiving it as a threat. Musculoskeletal system, muscles tense and can trigger tension headaches. Respiratory system, from quick breathing. Cardiovascular system, and that's because your heart is always increased. Your endocrine system, signals sent from the glands to the body can cause a release of cortisol into the body to fight a perceived threat. And gastrointestinal system, eating habits may change, and the feeling of butterflies in your stomach may occur a lot. Now, is there a balance? Can you find a balance between life, family, career, work? A normal condition is the ROS production, and this is where your metabolic and your antioxidant rate is stabilised and is at a normal level. However, if you can't balance, then it makes your NADPH-GSH, which is a hormone in your body, and the glycolysis, which is the tumour processor, if this is out of sync, it can make you more susceptible to developing cancer. So is there, or can you find a way of balancing work, life, family, career? Is it possible? The next slide is what people do when they're stressed. So if you're a very negative person, a lot of negative people can either shut themselves away, deactivate social media, turn their phones off, and just literally cut themselves away from people. Other people turn to drinking alcohol. Other people turn to illegal substance abuse. Even some people can feel so stressed over amount of time they end up turning to violence or start smoking just to relieve that stress. Go for a fag and it takes all the problems away. However, it's increasing the problem. Positive people may talk to others, go for a run to take the mind off things, which has been known to increase a chemical in the brain which makes you feel able to sort things out in your mind better. Meditation, taking 5 minutes away from your day and just meditating to quiet your mind, reducing that stress on your body. Writing in a journal. If you've had a very stressful day, just writing in a journal how your day has been can help. And being more mindful and breathing. If you have a stressful event that happens, breathe through it rather than triggering with anger. Tips for managing stress. Cynthia Wright wrote, "A quietness with thoughtful reflection and a relaxation can be very empowering," with a beautiful photo of the water behind it. So here are some tips for managing stress. Listen to some music. You can either listen to calming music or one that's going to take your mind off the stressful situation. I would be mindful with heavy metal, as heavy metal can obviously cause your body and your heart rate to increase. So when you're listening to music, take into consider something like Raindrops, or even get the Calm app and listen to that. Take some deep breaths if something's really, really stressing you out. Take 5 minutes out of your day, or go to the toilet and just sit in the cubicle if you're in a situation where you're working in a supermarket. If you can take 5 minutes and go to the car for 5 minutes and just take some deep breaths and just try and release that tension from your body. Leave the room for 10 minutes. If you're at home and you're around the children all the time, or in a family environment where you can't get away, just try and get 10 minutes to sit outside by yourself, upstairs in the bedroom, or maybe even in the kitchen, and send the kids upstairs. Breathe for 10 minutes. Focus on relaxing your muscles to release tension and encourage your body to relax, as it's really important to not have that constant tension in your body all the time. It's super important to try and take some time for yourself, because as you can see and what we've spoke about, stress can cause some serious changes to your health. So try and be more mindful, try and breathe, and try and focus on things that are not going to cause you a lot of stress, and see if you can find that everyday balance. Thank you for listening, and I hope you've enjoyed the presentation.